Welcome to my weekly roundup. Well, this week, although the House of Commons is not sitting, the Public Accounts Committee published our report about the government's response in health and social care to COVID-19. We were particularly critical of the discharge of patients from hospital into care homes and the lack of support for the social care sector. And we've urged the government to come back with a detailed plan by the 1st of September about how it would deal with a second spike, particularly in supporting social care with PPE testing and wider support. It's vital that the social care system is seen as part of the health system and not an afterthought, and we'll continue to pursue this from September. It's interesting to note that the Prime Minister's own language has shifted slightly. With the rise of cases in Europe, he's moved a bit away from his gung-ho approach to beating the virus to one that is urging slightly more caution. I hope this is a sign that the government's willing to acknowledge its mistakes and learn from it for what might be a second spike in the autumn. And on a point of good news, the Homerton Hospital has now agreed to pay workers outsourced on an ISS contract, that's porters, cleaners, security staff and others, the same sick pay as people on NHS contracts and the national living wage. This is good news and a result of hard work by the trade unions and others to make sure that where there's equal risk, there's equal reward.